Hello, everyone. My name is Jonathan D. Rothewell. I work at Harry S. Truman College in the United States. I am an English professor with research in health communication. I also study chemistry. Today's topic is about finding new modalities to educate patients, specifically through comics. I read comics quite often, and a few months ago, I found a comic series drawn by Braun Smith titled Health Capsules. I found it to be very interesting and thought it may lend potential insight to patient education and health communication. It is well known that people learn in different ways. Some learn better through reading, some learn better through being taught, to name a few examples. Within health communication, patient education is of huge importance. Proper communication with health systems can improve clinical relationships and may help mitigate fear. In some situations, visuals, when accompanied by verbal communication, can increase understanding. Just as language has different techniques to make meaning, such as intonation and tone, visuals use different meaning-making modalities to help promote understanding. Some examples include facial and bodily expressions, ellipses, vectors, and distances. These can all be used to make meaning in a visual. In my personal experience and research, visuals may be underutilized in healthcare settings. In this study, I selected 5 comics from the Health Capsule series for a close reading and visual analysis. Today, we will look at 2 of the comics briefly. My analysis was informed by previous studies, which set a framework for the analysis of visuals. Here is a health capsule about chronic pain. It starts with a question, includes simple language, and includes an explanation. How common is chronic pain? My head hurts, and my feet hurt, and everything in between. Approximately 89 million Americans experience chronic pain lasting longer than 3 months. Lost production time at work resulting from chronic pain costs the US about $300 billion yearly. While these comics are not meant for medical advice, rather simply as factoids, these comics may have some merit. This one in particular uses simple language and visual to educate on chronic pain. However, if it were to be adapted for use in healthcare, I thought it was lacking proper illustration. The explanation could be more effective if symptoms of chronic pain were drawn as well as written about. This comic follows the same format as the first, with a common question, an illustration, and an explanation. What can I do to fall asleep faster? Try the ancient Indian yoga breathing technique, commonly known as the 4-7-8. Inhale through your mouth to the count of 4. Hold your breath to the count of 7, then exhale through your mouth to the count of 8. It is also used as a stress reliever. Great benefits can be realized with repeated use of this procedure. This comic presents information about falling asleep in simple language with a simple visual. It presents actual instructions for the patient. The accompanying visual is more effective than the previous. It shows the patient experiencing symptoms as can be interpreted from the dark circles and a forlorn expression on their face. It also makes use of ellipses, which is using black negative spaces to illustrate a sense of the unknown. This comic would be even more effective if breathing techniques were illustrated. This is an example of an instructional comic I found while researching. A study was done by Furono and Sasajima at a university hospital in Japan. Their results showed that patients found these comics very helpful. As you can see, these comics present actual instruction. Their illustrations support the dialogue. This portion of the comic translates to the following. Surgical clipping of the aneurysm is the most certain means of preventing rebleeding. Unfortunately, drugs are not effective to manage the aneurysm. The surgery is performed under general anesthesia. Depending on the location, the aneurysm craniotomy is performed and the brain tissue is exposed. This may be a very effective way to communicate such illness or procedures to patients. Research may indicate that there are potential benefits to communication and that the patient experience is improved when visuals are used. Health capsules may not be as effective as I originally thought, though they were not designed to be used in actual clinical practice. The research by Furono and Sasajima may be more effective as it illustrates actual ailments and procedures along with simple explanations. Ultimately, I believe more research is needed on the use of comics in medical settings. Here are the resources that I used in this research. Thank you for attending my presentation today. Take care.